And looks like we got about 8, 9 people.
Oh, good. Getting there.
Yes, we don't have our exercise class today, so we encourage all our exercise people to come to our Zoom sessions this week. So that some of them are in there, I can see.
Oh, do I have to push record?
And then are you all right, Anne, if I start admitting people?
Sure.
Okay. Good morning, Shannon.
Hello.
And Emmy, Janet.
Hi.
Good morning, Janet.
Good morning, Jessica. Good to be here.
Good. I'm glad you made it.
Me too.
And good morning, Frank. I'm going to be placing everybody on mute for the duration, but we will have a question and answers. Thank you for the thumbs up, Frank. We will have a question and answer section at the end. And at any time you can put questions into the chat and myself or Anne can answer those at the end. Good morning to those that just joined us. We'll get started here in a couple of minutes. And if you want to take a moment to look at the schedule for this week, if you want to write down any of the other days that you plan on coming, we hope to see you at all of our sessions this week. And the times are a little different each day, so don't forget to look at the times.
This must be the early bird group, right?
Yes, yes, it is. And good morning to those that just joined. There's 12 of us on here so far. We'll get started here in about a couple of minutes. Again, please feel free at any time to ask questions in the chat. If your friend isn't on yet, maybe give them a call and invite them to come. And we have our expert on with us this morning, Ms. Ann Stockman. Welcome to those that just joined. Happy Monday. And I'll be admitting people if somebody wants to join late or you know somebody who wants to still come, they can still come. Even a couple minutes late, they'll still get some great information. Okay, I do have 9 o'clock on the dot. Let me just get these last couple of people from the waiting room in to join us, and then we will get started here. Welcome to our virtual Healthy Aging and Fall Prevention Summit. today, Monday, our first kicking off our Healthy Aging and Fall Prevention Summit. October 18th, today we are talking about diabetes and oral health. And we do have our expert Ann Stockman here with us today. We'll hear from her shortly. So again, here is our schedule for the rest of the week. If you want to review it, it is on our website, healthyagingassociation.org, or on our Facebook. You'll be able to find the schedule there. So if you want to sit in on any of the other sessions that are happening this week, please do note that the times do change. So today is our early morning session, but some of our sessions are in the afternoon. So today, again, talking about diabetes and oral health, we have Ann Stockman. She is the assistant professor with the School of Nursing with Cal State Stanislaus in Turlock. So she's local to us. And myself, Jessica Enos, I am the fitness program coordinator for Healthy Aging Association. I just want to note that this session is being recorded. If you are uncomfortable, you can feel free to turn off your video at any time. And the recording will be posted on our website and social media page. If you're not able to stay for the whole session, or maybe you know somebody who might want to watch this recording later on, they are more than welcome to watch the recording. And we will have all participants muted for the duration of the session. Again, if you do have a question, we will have a little question section towards the end. And if you want to put any questions into the chat at any time, you can do that as well. We want to say a big thank you to our sponsors for the Healthy Aging and Fall Prevention Summit. Without our big sponsors, this event would not be possible. So we are so grateful for them and all the support that they have given us, especially our presenting sponsors, Kaiser Permanente and the Stanislaus County Area Agency on Aging. We are so grateful to all of our sponsors, even our Emerald sponsors and our Sapphire sponsors. And you will see items from these wonderful sponsors in your tote bags, which I'll get to talking about in just a minute. But you will receive resources from each of these in your tote bag. And also on our website, we do have their information so you can see what they offer for our community and especially older adults. And then as I was talking about picking up a tote bag, our drive-through distribution so that you can come and get an event bag. They are that very pretty teal color up there in the top right corner. We do have a distribution tomorrow in Ceres. If you live in Ceres, we will be there tomorrow, Tuesday, October 19th. We'll also be in Newman tomorrow. If you live in Newman, Wednesday, we will be in Grayson, Patterson, and here in Modesto. And then on Thursday, we will be in Oakdale and Riverbank. So if you live in one of these cities, you can come on through our distribution at the set time, and you will receive your tote bag filled with all kinds of resources and goodies from our sponsors. And it's just a drive-through, so you don't have to get out of your car. For the health and safety of everyone, we're going to be as safe as we can. So coming through that drive-through, you can pick up your tote bag. Again, it is just one bag per person and while supplies last. So you'll want to get your tote bag filled with all your resources and goodies. Again, if you have any questions about these distributions, you can give us a call. And so today's agenda, I did our introductions a little bit. I'm going to review and recap the videos that will be posted on our Facebook and our website later today. And then Ann and I have some points regarding the topics for you to take away from this session today. So again, if you have any questions, you can put those in the chat at any time. And Ann or myself will try to answer the questions to the best of our ability. So today we will have information posted on oral health and maintaining oral health on our Facebook and our website, and the importance of healthy teeth and how healthy teeth and gums not only affects our smile, but also just our overall health and well-being. Tooth decay and tooth loss can lead to many infections and surgery if it does get to that point. Gum disease may increase the risk of heart disease. So our mouth, a lot happens in our mouth, and it's very important to keep it healthy and strong. And then diabetes, and I'm sure we'll touch upon this. So I'm just going to mention that gum disease can be an early sign of diabetes. And also people with diabetes are more likely to have serious gum disease and other oral health problems. So I'll just say that, and I'll leave that for Miss Ann. And then how we can maintain good oral health, making sure that we brush twice a day, flossing daily, making sure that we see our dentist regularly for checkups and cleanings to maintain that good oral health. And also you will see information posted about diabetes today. For those that aren't familiar with diabetes, which I'm sure a lot of you are, diabetes is a disease that occurs when blood glucose, also called blood sugar, is too high. So Anna will get into that for us. I do want to mention briefly that Ann Stockman has created a video for us. I believe this is a picture from last year, Ann, but I love the graphic. Ann has created a new video for us on our Facebook and our website, so it'll be posted on both, that you can watch a short little video by Ann regarding diabetes. So that can be found on our website. The link is there. I can also put it into the chat. And then she will talk about staying healthy, staying active, eating healthy, knowing your numbers if you are diabetic, and how to prevent complications. So at this time, I would like to hand it over to Ann, who is our expert on diabetes. Again, if you just joined us, Ann Stockman is from the School of Nursing at California State University, Stanislaus, and she is also a diabetic educator. And she is our diabetes expert today. So, Ann, I would like to hand it over to you.
Thank you. So welcome you all for coming this morning. And if you can use your reaction button and give me a thumbs up if you or someone you know has diabetes, and that's why you're joining us today. So we'll look for those at the bottom of your screen. Everybody know how to do a thumbs up, or you could just show me a thumbs up if you know somebody or if you have diabetes. I don't see them up. Maybe they don't know how to do that. Okay. Oh, there we go. Okay. So I'm a registered nurse, and I've been a certified diabetic educator in our community here in Stanislaus County for a long time. But people are chatting in the chat room, ready to go. Okay. So I want to spend my time with you. You can look at the video, we can answer questions. I'm going to go through a few things that I think is real important, in that when you have diabetes and how you manage diabetes is very important. So you can go ahead and go to the next slide. I want to hit on a few points, but I really want to spend this time with you and answer questions, which could be your challenges in any of the things you have to do to take care of your diabetes. So, and encourage all of you to get to some diabetes education, go through your insurance company and have them refer you. If you've been to diabetes education once, hey, your diabetes changes over time. And so it's real important to keep going back to that diabetes educator or classes to hear the new stuff, to hear what else you can do. So as well as all the meds. So this last year and a half have been crazy with COVID. And a lot of you might have had telehealth visits, or maybe simply didn't go to the lab. But it's real important now to kind of say, all right, how do I get back on track on all the stuff I need to do for my diabetes? Diabetes just happens to be because every single cell you have in your body needs glucose, like gas needs a car. And when we have that imbalance, when your sugar is high, when you measure it, it's actually not getting into your cells to help them do all it needs to do to make your body work. So it affects every cell of your body, which sometimes you think, my gosh, look at all the complications from diabetes. Well, now you know why. So it's real important to keep a handle on where you at with developing complication of diabetes. If you've lived with diabetes for over 20, 25 years, you know, and been in keeping your A1C really well, you may not have that many complications. But sometimes, especially with type 2, you may not have known you had diabetes, and all of a sudden you got diagnosed, but maybe you've had it already for 10 years, and some of those complications might be happening. So how do you know, as you go down this road, if you're having this complication? So I kind of wanted to go through just some American Diabetes Association recommendations on how to take care of your diabetes, which we do in the office. So when you go see your healthcare provider, you should go 3-4 times a year. And how many of you could tell me what your blood pressure is? So your blood pressure, as you get older, most people, it does reduce a little bit, but people with diabetes, it could go up. Now, your blood pressure tells us a lot about what's going on with your cardiac and your kidneys. So we monitor that so we can see what's going on. And of course, you know, your blood pressure has to do with stroke. We watch your weight, BMI. I used to say, you don't have to tell anybody they're overweight, they know it, right? So watching your weight, long as you can maintain and not gain anymore, especially with type 2, we're fine. One thing that tends to happen as you get older, a lot of people lose some body fat, they may be thinner, and we have to look at different ways, right, to nutrition. Review your medications. So there are tons of medications out there for diabetes compared to when I first got out of nursing school, maybe 30 years ago. We only had maybe 2 or 3. And now look at all the insulins we have. So we need to personalize these medications for what's going on with you and your diabetes. So just because your A1C, your blood sugars have gone higher, doesn't necessarily mean that it's just because, you know, you ate a candy bar once in a while. Your diabetes changes over time, and different medications need to be added to help prevent complications as we go down the road. Most people should be on some kind of a blood thinner, either an aspirin, or if you're on a blood thinner that the doctor put you on, but check with your doctor, because people that have diabetes, when your blood sugar is high, think of your blood as, if you don't have diabetes, think of, okay, tomato juice going through your arteries, right? If you have diabetes, your blood becomes thicker, the cells are sticky, and so it may be like tomato paste trying to get through. And that's why a lot of people, it's recommended everybody with diabetes be on some kind of a blood thinner to decrease your chance of having a heart attack. Okay. Lab work. You should go get your lab work, but how many of you know what your A1C is? So if you know what your A1C is, we're really heading for that to be between, as you're older, 7 and 8, right? And if it's not, then we need to really look at what's happening the last 3 months prior to that test. Lipid panel. So I'm talking about your good cholesterol, your bad cholesterol, your triglycerides. Do you know what your numbers are, and what does that tell you, right? Believe it or not, part of your lipid panel, your good cholesterol, that tells us a lot about how you exercise, right? So we can tell if you're exercising enough for your body, and you can exercise to counteract the bad cholesterol, okay? Dental exam is real important. Jessica already talked about that. The other thing about, I want to say something about a dental exam. Personally, and I know a big difference in my picture from last year from this year, but well, during COVID, I saw some white spots under my tongue. Never smoked a day in my life, but I ended up having cancer under my tongue in the back. Had to have, like, you know, surgery and everything, went through radiation, chemo. So you need to look at your mouth. It's like your feet, right? You need to look at your feet. Can't just stand on them all day long or put socks and shoes and forget it. But those are areas you really need to look at, right, to do it. get to your dentist. A lot of people have diabetes. Your dentist is going to want you to have antibiotics before he'll do any work on you. So you need to do that. On a yearly basis, you need to go to the eye doctor. Now, not one that gives you a pair of glasses, but one that optometrist who can do a dilated eye exam to look in the back of your eye to see how your little vessels are doing. A foot exam. I like to know how many of you have had a foot exam by your doctor with the monofilament. Next time you go to your doctor, take off your shoes and socks. He's going to think something's wrong with your feet, but make him inspect your feet. How many of your doctors use a little, looks like a little broom, piece of broom, real thin, that they poke to see how your sensation is, which tells us how your feet are doing with feeling and neuropathy. Okay, kidney function. So simply by doing a urine specimen for microalbumin, that can tell us, plus the lab work on your kidney function test, right? A stress EKG. If you haven't had an, you might have an EKG in the office, and that may be fine, but a stress EKG can now put your heart when you're under observation by the cardiologist, give you, used to have to put everybody on the treadmill and do it, and now they can just simply put an IV in you, have your heart work like it's a big workout, and the doctor can observe what happens in that stressful situation. It's good to have that on record. They may tell you, hey, you don't need to come back for 5 years, but you may come back sooner. So when do you get all this work done? You get an annual physical exam with the doctor, and that's a lot of information for you to take in or him to do. Ask for an annual diabetes exam to look at all this results. And I tell my patients, hey, do it on your birthday, around your birthday month, because you'll remember. And let him do these tests, even if they're 3 months before or 6 months before, and then talk about the impact of all this on your diabetes and where you're at with complications. So by keeping your blood sugar in good control, you can slow the rate at which you get complications. But you really need to know what to look for in some of these complications. So we can ask, we can talk about ways to reduce it with, diet and exercise and challenges you may have. But I just wanted to bring this up because some of my patients, if I ask, well, what's your A1C? They may go like this, I don't know. And then, my comment has always been, well, who has diabetes, you or the doctor? And you have it, right? Or if you take care of, your significant other. So you really need to understand, where are you? It's hard to live with diabetes every day, right? And say, well, I was a failure today because I didn't follow my diet, I didn't exercise, I didn't do that. But by knowing the big picture, right? What is your A1C, that 3-month glucose average? And where are you at with all these complications could really make you enjoy life a little bit better and not have that diabetes distress all the time about all the things that you need to do. And really taking care of yourself, besides your medications, eating healthy and active is nothing different than everybody should be doing, right? So, all right. So now I know Jessica's back, but can we take some questions or let everybody unmute and ask me some questions? And let me see if I can, what challenges you face every day with your diabetes or anything I've talked about. So I see somebody's in the chat. Just say yes. Any questions? You can either type it in or unmute. Let's see.
And you do have the ability to unmute yourself, so feel free. Anna's here for you.
Jessica, what's our time framing too? I just don't want to go over for these people too.
We have about 5 minutes, and then we'll do 5 minutes of wrap up.
Okay, so who could tell me what the biggest challenge is in dealing with your diabetes? What do you have the most trouble doing? Anybody want to share?
I don't have I'm sorry.
It's okay. Is that Eleanor?
Yes, just a moment, please.
Okay.
I don't have diabetes, but
What is the value of a dental exam? I know friends that have diabetes, and some of these things are, they don't understand why they're important. So you should have a dental exam, even if you wear dentures, if you wear those kind of things.
Oh, especially if you wear dentures, and especially if your weight has changed, because if you've lost weight, your dentures won't fit in your mouth, and that rubbing could make sores in your mouth. If when your blood sugar is higher than normal, then the bacteria in your mouth and gum disease is higher because of that, right? So that's why you really need to get your gums and your teeth checked out, be ahead of it versus behind it, where, you know, you have to have a root canal or an abscess or something has to happen. Okay.
Thank you.
Mhm.
And we have a response to your question about what is one of the challenges that people face with diabetes, making life changes.
You know what? And that's the hardest, right? I think thinking it, so instead of life changes, all the things you have to do with diabetes, right? But think about, what can I do to be healthier? So start small. The doctor might give you a list of 5 things he wants to do, but you need to negotiate what makes more sense to work on first. So is it the get more active, because that helps lower your blood sugar and utilize that insulin better? Or is it, I'm going to try to change my diet, right? Everybody has eaten the way you've eaten for your whole life. So changing that can be the most difficult. But think of it like this, for your plate, at least. Your plate's the same size. Try to change the portions of stuff you have on your plate. Increase the amount of vegetables, salad, vegetables, to maybe half your plate. Less of that carbohydrate, more protein. Just little things like that can start, instead of thinking, oh my God, I've got 20 million things to do today for my diabetes. I hope that helps. Or tell me more specific what it is. Who else? Anything else?
Well, actually, that kind of answered the next
Okay.
person's comment. So Teresa mentioned that she faces issues of stress and testing herself daily, that her doctor knows her well and has allowed her to stop testing because of she follows a fairly strict diet, but wanting to know more information on dieting, which you had just mentioned, eating. So there is so much information, and she is trained in nutrition, so she does have knowledge, but she wants to do better.
Okay, so let me talk about this real quick. How many times a day do you think your blood pressure your blood sugar changes? Take a guess. Anybody? Okay, so every minute could be different. When you test it one time a day, it doesn't really give us the picture. What does that number mean to you? So a good way to get a handle of what you're eating and what it does to your blood sugar is to test your blood sugar right before you eat, within 15, 20 minutes, right before. Get a number. Let's say it's 100. 2 hours after you eat, take your blood sugar again. It should be close to normal or only go up 40 more. So if it goes from 100 to 140, whatever you had on your plate was a good glycemic index for you. If it goes from 200 to 240, still a good meal for you. But what bothers me is, why is it 200 before the meal? And that's what you need a diabetes educator for, and your physician, to kind of look at your meds. So just because you take it one time a day may not give you really what's going on, since it changes so much. But if your A1C is in good control, you're doing things right, and you shouldn't have to test. But if you're testing 3 or 4 times a day and those numbers don't mean anything to you, you may want to do it a little differently to give you feedback on food. Does that help?
I have a question. That means then when a person checks the blood sugar in the morning, it's not enough.
Do you have type 2, type 1?
My husband.
Okay.
Type 2.
Type 2. Okay. So do you know what his A1C is?
No, I'm not too familiar with the information.
So remember I said the 1,400 times a day, your blood sugar is different. And we're not going to have you test that many times a day, right, to figure what's going on. But this blood test measures your glucose 1,400 times a day for the last 3 months. And it gives you a number. And 7 is close to 120, 140. So if you get this A1C and it's good, then I would test, pick a meal every other day and do before and 2 hours later and see what it is. Because if those numbers don't mean anything for you, then don't test. Now, first thing in the morning, if your blood sugar is over, I would say 130, 140 on fasting, maybe we don't have you on the right medications. And the medication that we're going to see the best result, because it works on your liver at night when it spills out all that sugar, is metformin. So metformin and getting that right dose, that AM sugar is going to tell the doctor that too.
Okay, thank you.
And then, Anne, there was a part 2 to that other question regarding nutrition and dieting. What do you think is the best plan, keto or others, for diabetics to follow?
Okay, so the keto diet is really not a good diet for people who have diabetes because of the stress on the kidney, and especially for anybody over 65 and the age of your kidneys. So long-term keto, not good for anybody, but people with diabetes, there's other ways that you can do it. Is that, or more specific, if you had an age group for nutrition? I don't know what, does that answer that for you?
65 plus, she mentioned.
Yeah. 65 plus, I would say keto, check with your doctor, but keto is not really a good idea unless you have really good kidney function. And with all the meds people are taking as you age, we don't suggest keto long-term for elderly.
And then last question for you, Miss Anne. How many carbs can be eaten per meal?
Okay, so depends on your age, your activity, but 45 carbs, maybe 6, 45, 30. Women be different, maybe 30, 30, and 45. But the biggest thing for you is different carbs will affect your blood sugar differently, even if it's 45 grams. Use your blood sugar before you eat. 2 hours later, take it again. If it goes up more than 40, then that combination of carbs for you was too much. Do something different next time you eat that same meal.
Perfect. Okay. Oh, thank you is her response. Again, as I mentioned, if you joined us late, Anne has pre-recorded a video for us with some great diabetes information. It will be posted, actually it is posted on our Facebook and our website currently. So you can go check out our website and watch that video. If you do have any questions regarding that video, you can always email Healthy Aging and we can make sure that we get that information to Anne to get you an answer or a response. So again, you can find that video on our Facebook or our website, www.healthyagingassociation.org. And you can go ahead and watch that diabetes informational video by Anne Stockman. And Anne has provided some great resources for us. Again, this is a recorded video, so you will be able to go back and see these great resources. So Doctors Medical Center, as Anne mentioned, how important diabetes education classes are. Doctors Medical Center, they offer classes and resources to manage your diabetes. Also, as Anne mentioned, important to talk with your insurance and maybe your doctor, and maybe they provide some education classes. The Association of Diabetes Care and Education Specialists, they have some great resources for people living with diabetes. And on YouTube, Marshfield Clinic does have some good information on dental resources. dental health and overall health. Also mentions diabetes a little bit, but some great resources for dental health. So you can check out those YouTube resources, and hopefully they will be informational for all of you. And we are so grateful that Anne could join us this morning for our diabetes and oral health session for our Healthy Aging and Fall Prevention virtual summit. Again, this video will be posted onto our Facebook if you missed the beginning, where we talked a little bit about the information that is going to be posted on our Facebook throughout the day and the resources that are available on our website currently for the summit. And also information, I know a couple people jumped on late, information about our distributions that are happening this week. To get all the resources and goodies in the teal tote bags. And we hope to see you here or it'll be here. It won't be tomorrow morning though. So just make a note. Tomorrow we will be talking about healthy lifestyles, mind and body, but it will be at 3:30 p.m. So you'll use the same link that you used today, same ID and password, and Dr. Robert McGrew will be joining us tomorrow as we talk about healthy lifestyles. So thank you again, Anne, for joining us and answering all those questions. And we look forward to seeing all of you hopefully tomorrow. Thank you, Anne, for joining.
Thank you.
We appreciate your expertise.
Okay, have a great day, everybody. Get out there and walk. It's cool.
Yes, it is. It feels great.
Mhm.
Take care, everybody.